Hi, my name is Bridget Baronic, and this is my communication campaign to promote seasonal flu vaccine uptake among undergraduate nursing students. Influenza, or the flu as it's better known, is an endemic respiratory illness that spreads easily from person to person. The burden of disease changes each year depending on the antigenic drift of the virus itself, vaccine coverage, and vaccine formulation. It ranges anywhere between 3 to 11% of the population, which either way results in millions of illnesses, hundreds of thousands of hospitalizations, and tens of thousands of deaths each year. Vaccination is one of the most effective methods of prevention available, and during the 2019 and 2020 flu season, the Centers for Disease Control and Prevention estimated that over 7 million illnesses were prevented through vaccination. It's recommended for nearly everybody over the ages of 6 months, and yet coverage remains very low across the United States, especially in certain groups. The 18 to 49-year-old range is one of those groups. This age range encompasses college students. College students are at an elevated risk for contracting influenza because they live and socialize in close quarters. And their coverage is important because it can help protect the students on the campus, of course, but also the community at large and the students, friends, and family, especially if they're traveling home. They could bring the illness back to their hometowns. 9 to 30% of college students receive their flu vaccination, which is below the numbers for the general population and well below the Healthy People 2030 objective of 70% of the population. Vaccinations of particular interest in students that are majoring in health fields because they'll serve as role models for the general public and interact with patients in the future. And research suggests that flu vaccination campaigns need to be further segmented within health majors for appropriate messaging. So my campaign will focus specifically on undergraduate nursing students. The campaign will be guided by two primary goals and several objectives. The first goal is to increase influenza vaccination uptake among undergraduate nursing students. The first goal will be supported by objectives that seek to promote positive intentions towards vaccination. And the second goal is to reduce misconceptions about flu vaccine. The associated objectives aim to promote positive subjective norms and increase relevant knowledge about flu vaccination. The literature suggested that the health belief model and the theory of planned behavior are both appropriate models for flu vaccination. The theory of planned behavior postulates that intentions influence behaviors, and the theory is composed of attitudes, subjective norms, and perceived behavioral control constructs that are thought to make up intention to perform a particular behavior. Several studies have found that in college students, primary predictors of vaccine uptake are attitudes and beliefs surrounding vaccination, subjective norms of family and peers, and control elements such as time and cost. Furthermore, nursing students, an added construct of moral norms has been found to influence intentions and behavior. A 2014 study by Cornelli and colleagues found that the theory of planned behavior could explain 41.9% of the variance in vaccination uptake among undergraduate nursing students. A review of the literature examining flu vaccination predictors and barriers among undergraduate nursing students has several important indicators for campaign planning. Attitudes that precluded vaccination were a belief that the flu shot may actually cause the flu, a belief that side effects were serious, or a belief that the shot was not necessary for protection. Undergraduate students were more likely to rely on friends and family as referent others, whereas graduate students were more likely to rely on medical advice when considering the vaccine. In student studies examining nursing students, the addition of moral norms was also found to be a predictor of flu vaccination. Knowledge was a predictor as well. There's a statistically significant knowledge gap between vaccinated and unvaccinated students in the literature. And finally, time barriers were often cited in students who did not receive their flu vaccine. The campaign strategy will be a social marketing perspective grounded in the theory of planned behavior. The theory of planned behavior will include moral appeals as part of subjective norms. Messaging will address vaccination predictors and barriers in the undergraduate student nursing population, such as time, moral and subjective norms, education, and beliefs. The campaign will be led by a coalition composed of members of the Student Nurses Association and the Black Student Nurses Association in conjunction with the College of Nursing and the Student Health. In this scenario, 3 on-site vaccination clinics will be held at the College of Nursing free of charge. Communications will begin 3 weeks before the first clinic takes place, and multiple communication pathways have demonstrated greater effectiveness, and thus multiple communication pathways will be utilized in this campaign. Student nurse ambassadors from the associations will make classroom visits and announcements and distribute informational pamphlets to fellow students. This will provide an opportunity for two-way communication and address subjective norms, education, and beliefs. Flyers with clinic information will emphasize the convenient location and free, free nature of the events, targeting perceived behavioral control elements. Flyers will also aim to address moral norms through campaign slogans centering on patient protection. Email communications via the nursing college newsletter will also be sent with information, and it will invite nursing students to sign up to give flu vaccinations as part of their clinic hours, which will further promote subjective norms. On the day of the clinic, reminder communications will be sent, and there will be a frame prop for students to take pictures with after getting their vaccine. With permission, photos will be used on the college's social media sites and future email communications. Students may also share their photos via social media, and this will hopefully also promote subjective norms among students. Several artifacts for the campaign have been included on this page. The first one on the left is a sample pamphlet that the student nurse ambassador might distribute that addresses common flu vaccination myths along with useful clinic information. The other two are example flyers that can be used to communicate clinic information, and moral appeals are also included in the messaging about protecting patients, family, and friends. The frame on the left is a sample of one that could be made larger to use on the day of the event that students could hold up and take pictures with. And then the artifact on the right is a sample newsletter detailing clinics, emphasizing that they will be quick and convenient as well as free. An evaluation plan will seek to understand the effect of the program through 3 primary questions. Listed here on the slide. How has the campaign affected flu vaccination uptake among the undergraduate nursing students at the selected college? How has the campaign influenced vaccine subjective norms among undergraduate nursing students at the selected college? And to what extent did the campaign influence attitudes, beliefs, and intentions towards the flu vaccine in the selected population? These questions will be answered through quantitative data collected at the event, 2 group pre- and post-test surveys of college nursing students at the selected college and a comparison group of nursing students at a nearby college. And then subjective norms will be measured through a 1-group time series key informant interview that's administered via email. And then lastly, intentions will be measured in a 2-group pre- and post-test using the 5C vaccination acceptance tool. And this will use the same groups of nursing students at the selected college and at the comparison college. Thank you so much for taking the time to watch my presentation today, and here are my references.